Hi, my name is Esther. I'm a med-surg nurse at a local hospital here in town. I'm going to be showing you how to insert an indwelling subcutaneous catheter. For demonstration purposes, this is our patient, Mr. Anderson. We've chosen his abdomen to place this sub-Q catheter. There are many other options, just as you would give a subcutaneous injection. When you first go in, make sure to always introduce yourself to your patient, let them know what procedure you're going to be doing, and answer any questions that your patient or the family has. Set up your work area and go ahead and prime your tubing before you place your catheter so that it's nice and convenient. Wash your hands and we are ready to begin.
So your patient's catheter might be put in at the hospital, in the clinic, or even by a home care nurse. Many times in the hospital, patients will go home with these, and so teaching is very important, especially on how to maintain it and what medications can be giving, which we will discuss in our PowerPoint later. So what you first want to do is pick a site to insert the catheter, away from skin folds or edge of clothing. We're going to be using the abdomen, but you can also place it upper thighs, upper arms, any place you can give a subcutaneous injection. For confused or agitated patients, you can also use the scapula, the shoulder blade, or lower back. Also, another common place is on the upper chest. So, Esther, prepare the work area, which I've seen you done. And you've washed your hands and gathered supplies. We have chlorhexidine wipes, skin prep, the subcutaneous catheter. We commonly use a 18 or 20 gauge for this. We need a sharps container, of course. Okay, we'll first start by picking a site. We're using the abdomen. Clean the site with chlorhexidine for 30 seconds and let it dry. That was 30 seconds. Okay. Apply skin prep to protect the skin and make the adhesive stick better. Open the catheter package without touching anything inside and lay it flat on your work surface.
Which I've done.
Okay. Pick up the catheter. With your other hand, take off the cap. With your other hand, pinch up the skin at the site. Insert the catheter at a 20 to 45 degree angle in one smooth, quick movement. We'll place the needle in the sharps container. Continue to hold the catheter in place while you apply the tegaderm, which we're going to pretend that's a tegaderm, since we students are used to improvising. Make sure the injection site is covered with a clear window first, and then press around all the edges and the outer edge of the catheter to make sure it's secure. Be sure and tell the patient that no bathing or exercise until it is well attached. So now go ahead and apply your tubing, which has been primed.
And as we said before, we've already primed our tubing with some normal saline. You can use different lengths. This is a little bit longer than we would normally use, but for demonstration purposes, this is what we're using. This would be capped. We didn't have an extra cap, so we go ahead and clean that off for 15 seconds. And we're going to go ahead and hook it up here.
To make sure that it flushes, is patent.
And we're flushing good.
Perfect.
You can also put this around
Secure.
and adhere one more piece of tape, just for extra security. And there you go. That is how you insert an indwelling subcutaneous catheter.